Hi, my name is Jessica, and I'm really excited you're here today to learn a little bit more about adrenal insufficiency. Come on, let's take a look and learn some more. When Cal was 8 years old, he got flu-like symptoms, and when he was sick, he had a little bit of vomiting, he had some fatigue, kind of like flu-ish symptoms, and what was really concerning is when on day 3, he couldn't walk on his legs. His legs were so weak that he couldn't even stand for more than 10 or 15 seconds. So once that occurred, that's when we knew things were not good, and we rushed him to Children's Hospital, and they did a bunch of tests. And he was in the ICU for 4 days, and his levels were so low, his sodium levels were so low that you can only go up 3 ticks an hour, or you can have seizures. And so it took 4 days really to get his sodium levels back up to normal levels. And so the crazy part was he actually was getting better in the hospital every single day because his cortisol levels were going up, obviously not knowing how low his cortisol levels were at the time. And so it was great in the hospital because we really kind of saw him coming back to life. Cal has gone into 3 crises in 5 years. They were all within the first year of diagnosis. The first year of diagnosis is really tough. You're really kind of learning how to manage the disease, and unfortunately he did have a pretty bad crisis, being the first one that he ever had. So he went to sleep the night before, and he was kind of having some symptoms, a little bit of a runny nose, a little bit of a sore throat, but it wasn't anything crazy, and at the time, you know, he didn't know his body as well as he does now. So he didn't really communicate that to us at the time. And so he went to bed that night, and when I woke him up for school the next morning, it was a really scary sight. So he was unable to roll over in bed, he was unable to communicate, and he was basically unable to move. He was still somewhat conscious, but he wasn't functioning like a normal person should. So I knew right away that things were bad, and that we needed to get him to the hospital right away and get him his emergency injection. So that was a really scary thing for us. You know, obviously walking into your child's room in the morning and seeing him, I mean, I wouldn't say he was unresponsive, but he definitely was, you know, it was like moving in slow motion, basically. And that was a really scary situation for us. Being diagnosed with adrenal insufficiency is actually really hard. We have 20 to 30% of our patients where it takes over 5 years to get a diagnosis, and they have to see over 3 doctors over that span of time to get a diagnosis. So if you come across somebody in the field who says they have adrenal insufficiency, no matter which kind they have, that means they've gone through a thorough amount of testing. That means that they've gone through sometimes the end of the earth to get that diagnosis. So I want to make sure that that's kind of clear and out there. Having a rare disease and being diagnosed with a rare disease is not easy. So it's something that you shouldn't take lightly. I'm not going to name other disease states, but there's some other disease states that don't take as much time and energy and effort to get a diagnosis. Adrenal insufficiency is not one of them. I'll talk about Cal's symptoms first, and then I'll name some of the other symptoms that some other patients also experience. So for Cal, a lot of times the first thing that he has is a headache. Sometimes, like if he's at school and the nurse will call me, we can do electrolytes and a salty snack, and that will kind of eradicate his headache a lot of times. The other symptoms that he may have is stomach pain and the weakness in his legs. So he describes it as like a weakness or a pain in his legs. And so whenever it gets to that point, I know that things are kind of going this way for Cal. So we really have to make sure that we're updosing and staying on top of things when his they call it flank pain sometimes, when his flank pain in his legs start to come into play. Some of the other symptoms that you may see for low cortisol would be vomiting or diarrhea. And something else would be, think of your college friend who's in a drunk-like state. It may be that their words aren't coming out correctly, they are talking very slowly. I always ask Cal if he can jump on one leg because his motor skills come to an absolute crawl. So when he's going into a crisis and going into a bad place, he literally can't hop on one leg. So when you see someone who's in a drunk-like state, and a lot of times we'll be having, like I said, the vomiting and the diarrhea, you really should be concerned, and they need to be looked at right away. Now that I've been an AI mom for 5 years and we've been through a lot of scenarios and a lot of situations, Cal's only 13. So a lot of my fears come looking forward. So some of the fears I have is when he turns 16. And even though we have emergency kits in all of our glove compartments and they're labeled, he has all of his medication in there. What scares me is if he were to get into a bad wreck, our first responder is going to know that he has adrenal insufficiency. Are they going to know that his medication is in the glove box, as an example? Some of the other things that probably keep me up late at night, a scenario would be, like I said, he plays football and he wrestles and plays basketball. Some of the things would be if he's out on the football field and he gets a concussion on the field and he is unconscious. That's an emergency situation and he needs his injection right away, no questions asked. I always have my kit with me, so it's not a matter of necessarily having the steroids with me, but it's a stressful situation. And when I am 20, 30 rows up in a huge stadium, I just kind of envision myself, am I running down the stadium and hopping over all these fences, and am I going to have my wits and the wherewithal to give him this 14-step injection? And I think that's what scares me, is that even though I can tell you how to do this injection frontwards, backwards, upside down, I teach people all the time how to give this injection. What scares me and worries me is in certain situations, high stress situations that really kind of come about very quickly, you hope and pray at that moment that you're going to do a great job and that you're going to rise to the occasion. But it's scary to think, what happens if you draw a blank? What happens if EMS doesn't come quickly enough? Or what happens if there's nobody else there to give the injection? And so I think some of those fears probably are common for a lot of AI families and a lot of AI parents especially. And so it's probably good to understand some of those fears that we have on our side. So this is Cal's kit. Everyone's kit looks a little bit different, but this is Cal's. I'll open it and show you a couple of the contents inside. The most important, of course, is the Solucortef. And if you were to choose one medication or steroid to give in an emergency, Solucortef is always the number one recommended. So we have Solucortef, and I have 2 vials in here on the off chance that one breaks or you need a backup. Then I also have 2 sets of needles, so you have a lure and you have 2 different size needles, one to draw, one to inject. And then I also carry anti-nausea pills. You want to make sure that he's not vomiting, because if he vomits and he can't keep his medication down, that's also an emergency situation. So I always keep my anti-nausea pills in here. I keep a thermometer because a lot of times when Cal's cortisol levels are really low, his temperature also drops. So like when he was diagnosed, he was probably like around 94 or 94.5 as far as his body temperature goes. Everyone thought the thermometers were broken. So I always keep a thermometer in there just in case as well. And then I also keep electrolytes. Electrolytes really help adrenal insufficiency patients, especially when they're low. And so I always keep some kind of electrolyte in my emergency kit as well. And then I also have instructions on how to give the emergency injection. So if he's at a friend's house or grandma and grandpa's house or whatever, we have instructions on how to give the injection as well. It's very difficult to get an adrenal insufficiency diagnosis. So if you come across somebody who says they have it, please take it seriously, and please know that if you have a rare condition, most endocrinologists or specialists struggle even managing a lot of the symptoms and managing these rare diseases. And so a lot of us parents really have to take on a lot of that education ourselves, and we have to know this disease frontwards and backwards, because a lot of times we don't have the support that maybe someone with diabetes might have. So when we need your guys' help, it's really, we're calling because we really do need you, and we really feel like we're at the end of the line. I think is important for EMS to know is they're not always going to have their medication. They're not always going to be carrying their Solucortef with them. Obviously, in a perfect world, they are, and you're able to either help them with their own medication or inject them with their medication. But I think it's important to know that not everyone is going to have their steroids with them, and to make sure that if they have their steroids, to use their Solucortef and know that you can't overdose them. Having worked with a lot of AI families, some of the things that we've learned is not everybody carries their emergency medication with them, which they should be. And also knowing that in an emergency, not everyone is going to live up to your expectations. I'll give you a quick story. So there was a child, we'll call him Steven, and he was at school and he wasn't feeling well. He has adrenal insufficiency. He went to the nurse's office, and in the nurse's office, he collapsed. The nurse had his Solu-Cortef injection on campus and was trained in how to administer this injection, right? For whatever reason, she froze and was unable to give his injection. She calls 911, EMS shows up, and unfortunately, in this particular state, they are unable to help with patient-carried meds. So all they were able to do was load him up into the truck and drive him to the emergency room, where he was in such bad shape that they actually had to give him his emergency injection and then put him on a helicopter to the closest children's hospital because they were afraid that he wasn't going to make it. It's stories like these that I think really scare people and really want to make sure that we're working as a team, right, with our EMS providers, with our doctors to make sure that we have the injection, with our families to make sure that they know how to give this injection, because you never want to be in a situation like this child was in, right, where somebody didn't act, and then unfortunately, then when EMS came and they weren't able to give his injection, it really could have cost him his life. And so I think that's something that's really important to highlight, some of the fears that these families have. I think that scenario really kind of comes into play as some of our fears as parents and providers for adrenal insufficient patients. Working with newly diagnosed families, some of the things I've learned is people really get antsy about emergency situations. Is someone going to know how to give the injection? Am I going to have my steroids? Is there going to be steroids on the truck when they come if we don't have ours? And so I think a lot of the worry, really, to be honest, kind of comes around emergency situations, because a lot of us